Hello everyone, so in this video I am going to explain the CLL, that is chronic lymphocytic leukemia, that is chronic lymphocytic leukemia. So as we all know from the medicine that the most common genetic alteration in CLL is deletion of 13q. Q means the long arm. So here the deletion of 13q is the most common genetic alteration. Please remember this question, that the most common genetic alteration in CLL is deletion of 13q. Now the clinical feature. So for the clinical features, CLL is seen in the elderly person. So it is seen in the elderly person, and the earliest manifestation of CLL is, so the earliest manifestation of CLL is fatigue. Please remember it, that the fatigue is the earliest manifestation of CLL. Now, what is the criteria for the CLL? So the criteria for CLL is that first criteria is that in this absolute lymphocyte count is more than 5000 per mm cube, that the absolute lymphocyte count is more than 5000 cube. And the second criteria is that in the bone marrow more than 30% lymphocytes were present. More than 30% lymphocytes were present. And the third criteria is in this CD5 and CD23, both these markers were positive. So dual positivity is seen in the CLL, and it is seen on the flow cytometry. Please remember that it is seen in the flow cytometry. So this is the criteria for the CLL. First is the absolute lymphocyte count more than 5000 per mm cube. In the bone marrow more than 30% lymphocytes were seen, and in this we see the dual positivity of the CD5 and CD23. Now on the peripheral smear, what we see, as we seen here, that we saw the smudge cells were there. Smudge cells were there, or the other name for smudge cell is basket cell, and the, or we can say a parachute cell. We can say a parachute cells. So this we see here is a smudge cells, and it is not it is artificial. Please remember it, that it is artificial. When we press the slide, then the we find the smudge cells. So smudge cells is artifactual, and the other name for smudge cell is basket cell or the parachute cells. Please remember this it is very important. Now the CML. Now next one is the CML. Please, CML. So the pathogenesis of CLL. So the pathogenesis of CLL is translocation of 9:22, that is a Philadelphia chromosome, that is BCR is to ABL, that is BCR is to ABL. So here there is increase in the tyrosine kinase activity. So here there is increase in tyrosine kinase activity. So tyrosine kinase activity is increased in the CML. So for the treatment, we give the tyrosine kinase inhibitor, that is tyrosine kinase inhibitor is given for the treatment of the CML, that is imatinib. That is imatinib. Please remember it, that imatinib is the drug of choice for the CML. Now for the CML, we also have to study the stages of the CLL. So for the stages of the CML, we have 3 stages. First one is the chronic one. So first one is the chronic one. Second one is the acceleration. second one is the acceleration, and the third one is the blast cells. So these were the three stages of the CML. Now in the chronic phase, what we saw the blast count is less than 10%. In the chronic phase, we see the blast count less than 10%, while in the acceleration phase, the blast count is between 10 to 19%, while in the blast cells, the blast count is more than 20%. And also here in the acceleration phase, we see that basophils count will increase. Basophil counts will increase more than 20%, and we see a spleen size also increasing. And here we also see that there is increase in the platelet count is increased, that is more than 10 lakh. And also we can see that there is decrease in platelet count, that is less than 1 lakh. So in the acceleration phase, we see blast count between the 10 to 19%, and the basophils more than 10%. We saw the spleen size increase, means splenomegaly will going to occur. And here the platelet counts, either it is increased more than 10 lakh or either it is decreased less than 1 lakh. And in the clinical feature of the CML, so the clinical feature of the CML, we find a massive splenomegaly. So massive splenomegaly is seen in the CML. Now, massive splenomegaly is also seen in the first one is the CML, while the other one is the Kala-Azar. In the Kala-Azar also, we find the massive splenomegaly. So these were the two clinical diagnosis, that massive splenomegaly is either seen in the CML or in the Kala-Azar. So this is about the CML. I hope you get information of this video. Thank you. Bye bye guys.